We have seen a 3 times increase in the number of children being admitted to hospital with severe overdoses as part of suicide attempts.
He says the isolation is driving more students to try and kill themselves, and others are suffering from serious mental health problems. Pediatrician Dr. Anthony Crocco says in-person school is vital for children to feel validated and get the social contact they need. He and others at McMaster Children's Hospital want the classrooms reopened immediately.
The school transmission of COVID is extremely low. Schools reopening is not what's going to tip the balance of COVID cases in Ontario.
A group of top experts who've spent the last year studying the pandemic's effect on children are calling for schools to reopen without delay in an open letter to Doug Ford's government. We are on the cusp of a generational catastrophe. Our professional consensus is that these shutdowns have negatively affected all aspects of child development. It was penned by Dr. Tracy Valancourt, who specializes in children's mental health research, and co-signed by 14 experts from across Canada.
We may want to do things on a regional basis.
Ontario's Chief Medical Officer of Health, Dr. David Williams, supports a return to in-person learning before the province's staged reopening plan begins June 14th, suggesting yesterday the start of June might work for some areas.
It depends on where you live, and it depends on the number of cases of COVID in the community.
Dr. Anna Banerjee from the Dalla Lana School of Public Health supports a regional approach, saying it may be a good idea in areas with little COVID, but says it's too soon in hotspot communities, believing it would make more sense to wait until September, worrying that bringing them back now will lead to outbreaks.
And you bring in all these kids, and the majority of them are not vaccinated. Is that a smart thing to do when we're so close to starting to vaccinate these kids?
The president of one of Ontario's largest teachers' unions also supports a regional approach, saying it isn't safe to reopen in GTHA hotspots.
There's just an unreasonable degree of risk for my members.
Hamilton's Public School Board expects a mixed reaction from parents if a return to class comes soon. But it stands by its previously stated position that schools should be the first to reopen.
We expect that that decision will be made based on our local context, the numbers in Hamilton, the risks to students, staff, and families.
Hamilton Public Health agrees that the schools should be the first to reopen, but the timing is up to the province. In a statement, Dr. Elizabeth Richardson says she recognizes the critical importance of in-person learning to student well-being. Back to you.